Okay, welcome everyone to COVID-19 Rounds. I'm James Gertson, coming to you from Thunder Bay. I'm a family physician here and the Associate Dean of CPD. We've got a wonderful topic today, and we've got a great presentation team. Just a reminder to everyone, please put your audio on mute. We'd encourage you to turn your video off so you'll get a better presentation. And finally, realize if your video is turned on, we may be capturing you on our audio video recording of this session. And so that we would encourage you to turn your video off. A couple quick updates to share with you. And as mentioned, we've talked about the recording. We've talked again about audio and visual. I'd like to just remind you about the COVID-19 round site and online resources. And on the site that you came in today, there is an evaluation link, and I would encourage you to complete that at the end of our presentation today. In the presentation archive section, you will find the slide set for today already, along with a short, wonderful video that Mike will be sharing. And finally, if you go to clinical resources, it'll allow you again to look at pan-Northern resources. And just an update for everyone, as everyone knows, our COVID-19 case status has been fairly flat over the last several weeks. We've had a total of 318 cases in Northern Ontario, 14 of them are active, and we've had 12 deaths. On this website, you also will find resources on wellness and resiliency, and encourage you to use those resources. I would like to introduce our team who will be presenting today, and I'd first like to introduce Dr. Jonathan DellaVedova. Jonathan is a pediatrician in Sault Ste. Marie. He's had a passion and a commitment to learner, physician, and healthcare wellness throughout his entire career. Jonathan, I'd like you to, and as well, Jonathan's in a bit of a transition as he has been the wellness lead for Postgrad and is passing the baton in the near future. Over to you, Jonathan, to introduce the rest of our presentation team.
Thanks, James. And I would like to also extend a welcome to all of the members of our NOSM community, our students, our residents, faculty, staff, our allies in healthcare, and visitors. So I'm Dr. Jonathan DellaVedova. I'm here in Sault Ste. Marie. I'm a pediatrician here. I'm also the wellness lead for Postgrad, at least for the next couple of weeks, after which Dr. Louise Logan will be taking over. She's here with us today. She's an emergency room physician in Sudbury and very well respected and well known to our learners already. Very honored to be facilitating our weekly COVID rounds today on a subject that is very near and dear to my heart, and that is resiliency. Please bear in mind that resiliency is not about blaming individuals for systemic problems or suggesting that personal strategies are going to solve everything all by themselves. Resiliency recognizes that in medicine and in life, particularly during this pandemic, there are many factors outside of our control that can affect our well-being. And resiliency is about finding the personal power, not just to endure those and not just to adapt to them, but also to change the system for the better. We are extremely fortunate to have two respected experts with us today to discuss the subject. The first is Dr. Michael Kaufmann, who is a longtime friend of NOSM. Some of you may remember Dr. Kaufmann from his keynote presentation at Northern Constellations a few years ago. Dr. Kaufmann is a family physician specializing in addictions medicine and the founding director of the OMA Physician Health Program. This is an essential service that I work with very closely. Since 1995, the Physician Health Program has provided vital support to countless students, residents, physicians, and in my personal opinion, is the most important function of the OMA altogether. In 2003, Dr. Kaufmann was awarded a Queen's Golden Jubilee Medal, and in 2015, he was the recipient of the Misericordia Award from the CMA, recognizing career-long contributions to the field of physician health. Welcome, Dr. Kaufmann. Our second contributor is Dr. Diane Whitney, a very familiar face at NOSM. Dr. Whitney is a community-based psychiatrist in Thunder Bay. She has been the program director of the Psychiatry Residency program for the past several years. She holds several academic positions, including associate professor at NOSM. Her areas of interest and expertise are mood and anxiety disorders, psychological trauma, and women's mental health issues. She previously served with the Canadian military during the First Persian Gulf War, and during this recent COVID crisis, she has been providing essential education as well as support to the psychiatry residents and various other healthcare professionals. So welcome, Dr. Whitney. If you have questions during the presentation, please enter them into the chat feature. We will address those during the Q&A period that follows. And I'm just going to remind everyone to mute their lines to reduce interference. You can also enhance the quality of the audio by turning off your camera, even though we will greatly miss your COVID haircuts and your pet cameos and your well-curated backgrounds. Thank you, and please welcome Dr. Kaufmann and Dr. Whitney.
Hello, everybody. Am I up first, or is Diane going to say a word?
Go ahead, Mike.
Okay. I'll jump in. Thank you all, Jonathan, James, Diane. Thank you all for the opportunity to join you today. As Jonathan says, we're going to talk about resilience. And I wonder, James, we can bring the presentation up. We're going to do it with James actually showing the slides and doing the shift from slide to slide to be sure that you see them clearly. I'm on a rural internet connection. I live out in the country east of Toronto, and sometimes it's good and sometimes it's not so good. So hopefully you'll let me know if I need to shut off my video or do a call in to improve the audio, but so far so good. So I've been invited a few times lately to talk about this subject, resiliency in the time of well, in these times. And it's my pleasure to sort of circle back and take a look at some ideas related to resiliency, and I've tried to distill them down to a few important principles just to bring back for you today as top of mind. So let's get going, James, and we'll go past the disclosure. And really all I want to say there is I did retire from the OMA Physician Health Program 3 years ago, and was, after a short break when I caught my breath, was awarded the title of Medical Director Emeritus, and a contract came with that to continue to provide services to the PHP, which I am still doing to this day. And that includes this particular presentation. So I'm here courtesy of PHP, and thank you so much, Jonathan, for your comment at the outset. That really was heartwarming about that. So here are the objectives. Very quickly, we're going to have a short look at lessons learned from SARS, at least to some degree, and then touch on self-awareness around how we're doing, and inspired by a paradigm from the Canadian military, which Diane might be familiar with. But most of the time, I'm going to take you through the paradigm that I've used over the years called the basics to review the various different dimensions of resilience. So moving to the next slide, and this actually speaks right away. I inserted this slide for you at this time, thinking about just exactly what Jonathan said at the outset. You know, in recent years, the conversation in physician health has evolved, I'll say, and moved from a kind of preoccupation, if I could call it that, with personal resilience as the way to go, so to speak, in terms of our health and well-being, without meaning to play down the importance of personal resilience, but understanding that resilience needs to be embedded in a place, in a workplace, and in a culture that would have us be resilient. So the systems issues become very, very important, and the culture, which is the way we do things around here, also important. That really is the leading physician health and well-being conversation, and the one that I've been involved with mostly for the past several years. So it's interesting for me to go back, and I think we can move forward now. James, interesting to go back and just refocus, as Jonathan said, on our own selves. From SARS, we did learn that the pandemic-like environment situation that we find ourselves in, although SARS and COVID, of course, they're both coronaviruses, but the impacts have been not the same, that's for sure. The folks who wrote this article, and they're both based out of Mount Sinai, also included H1N1 and so on as other examples of epidemic or pandemic. They taught us, at least from that experience, that indeed healthcare providers do experience some impacts. They do suffer some mental health related problems. They may be acute, but most of us hunker down and focus when the thing bursts upon us. But over time, it was noticed that the emergence of symptoms, including the things you might expect, depression, anxiety, absenteeism, increased use or maladaptive strategies like smoking and drinking. There were higher rates of burnout, already on a background of high rates of burnout, so this is, of course, troubling. All of these things have been observed amongst healthcare workers of all kinds, some more than others, in the months and years that follow. So these are the times we are in, and these are the times that are unfolding and stretching out in front of us. So much of it yet to be learned, but I think it's likely that we'll see some impacts at personal health levels for us and our coworkers. That said, they observed that they saw symptoms emerge, subsyndronal. In other words, they weren't able necessarily to diagnose higher rates of mood disorders or substance use disorders and so on. And so their advice was focus on being resilient, focus on our own psychological adaptation rather than ramping up the ability to respond to people who are sick or ill. Next, James. So, understanding that we're in this for the long haul, they said, of course, look after those things immediately that you can control, that are within your control, usually practical things, and solve those problems, whether PPE related or work structure, schedules, what have you related, workplace related or personal at home related. They're in your control to manage them. Beyond that, let's look at the more personal, emotional, psychological coping and resilience strategies that we have developed or that we can expand that enhance our own support of self, support of each other, and importantly, reduce isolation. And that's really where I'm focused with you here today. In their paper, they did say, and going beyond that, and I dare say we will be going beyond that, because this is not a short, sharp event. This is a long-term event. And some of us will do reasonably well, and some of us will struggle. Either way, as time goes by, it will be important to take a hard look at what the meaning of all of this is for us as individuals and communities, and indeed for us as a profession, and to understand how we're going to change and try to make sense out of all of that. And sort of, even this is an important thought, and perhaps I'll even come back to it to close, take advantage of the opportunities that this time is actually providing for us. Next. Another presentation by a colleague where she used this little acronym NUTS, and she got it, I think, from a University of Montreal site. Some of you may know Mary Elliott from PMH. NUTS. This is our way of sort of validating, or a way of validating the way we've been feeling lately. And for novelty, and novelty is, or novel is in the name of the virus itself, so it's brand new. something we haven't seen before, and everything we're going through for most of us, if not all of us, is very new. It changes every day. It's unpredictable, like the virus itself. We just, from one day to the next, we're not always sure what's the right approach. Tremendous threat attached. I'm sure you felt it very powerfully, as did I, at the beginning of am I going to be safe through this? Is my family going to be safe? What's going to happen? And even a personal threat to ego strength around our professionalism and our competency. Some of us are redeployed, working in areas we're not familiar with, or less employed, spending less time doing what we love and need to do. All of this is unsettling, and plenty of loss of control around what's going on. So should you feel, or perhaps even more upset at the beginning than now, and who knows what's around the corner, it's completely understandable. Next, please. Now, back to the Canadian military. Well, this is from CMA, adapted from the Canadian military. It's the Road to Mental Readiness, if I remember the name of the program that the military developed. I've used this actually over the years. This is an adaptation, and you can read the screen while I speak. But it's a way of self-assessment. Enhances communication between and amongst ourselves as well, and talking about how we're doing. If you look at the color scheme going from green to red through yellow and orange, it's a sense on the green side where everything is fine and energy levels are good, through reacting to the stress, out of feeling the stress, let's say, without actually feeling hurt by it or overwhelmed by it. And then finally moving through to a sense of being injured by the unrelenting stress that we're feeling. So on the left, everything's fine. As you move through, whether it's emotional or cognitive or physical signs, or the way we may be behaving, irritability, distraction, poor concentration, aches and pains, poor sleep, all of those things becoming worse as you move from left to right to the possible emergence of illness itself. This is a way of being able to code or encode how you're doing. At a recent meeting where we talked about these, people were actually drilling deeper into this paradigm and looking at chartreuse, which I didn't know before that conversation, that chartreuse is kind of the blend between green and yellow, and amber is more of a blend between orange and red. So it gives us even more ability, more sensitivity to talk about how we're doing. And if you pop to the next slide, James, I've simplified it in this way: healthy, reacting, injured, or ill. You could also think of it as healthy, stressed, distressed, or ill, having to do with how we're feeling and how we're functioning. And the idea here in this talk in particular is, with this tool to help with your own self-awareness, what sort of strategies, or can I land on some essential strategies to help us all stay as close to the left-hand side, as close as we possibly can? And that's the goal. Okay, next slide. The basics. This was the paradigm I worked out actually quite a few years ago, when resiliency was the thing everybody wanted to talk about. So I organized my thoughts, did a lot of research around the elements of resilience, and just tried to organize them into 6 domains, because that fit with this nice little paradigm, this acronym of basics. If you show the next slide. Oh, by the way, these booklets that I just showed you are actually still available, and the PDFs of these original articles, there you go, are still available down at the PHP website, and there it is, the URL at the bottom of the slide there. So now to the next. These are the domains that I'm referring to in the next few slides. The physiological, emotional, cognitive, affect, psychological for the A. S is social, and I'm going to focus mostly on the close social relationships. I is a bit of a grab bag, intellectual. I put lots of things there as need be. but I'm going to just mention diversions today. C is for community of, again, all kinds of community possibilities, both at work or at home. But I am going to focus specifically on workplace or professional community today. And finally, the one that doesn't get a lot of airtime is S for spiritual. And by that, I'm really not meaning a faith community or a religious practice specifically, although you could extract a lot of spiritual support there. But more in terms of collective wisdom and compassion, and I'll want to focus on that as we wrap up today. So let's go ahead to the first one, which is B. I'll show you these as a reminder that I've always thought that practicing medicine for most of us, if not all of us, was like a high performance skill or activity. And that if we did think of ourselves as a highly trained athlete, I think that would put us into the kind of mindset that would be necessary for us to think about how important it is to look after our physiological health. So let's go to the next slide where the various different kinds of considerations are listed. And you know, I would have thought, and one time I have thought, these things go without saying. And they especially go without saying, I think, for most of you who I think may be working in a primary care setting, although of course not everyone. But as recently, even as days ago, I spoke to doctors who found themselves going all day long for one reason or another, without taking breaks at all, and without stopping to drink, and without having food, whether it was because of the PPE working in an assessment setting or operating room settings. Boy, once you get the work momentum going and the next thing is coming, whether you're in your office or in the hospital or whatever setting, we can forget, we can forget to stop. But our physiology doesn't forgive us for that. We don't get a pass for needing to be well hydrated or nourished or rested because of a noble pursuit or noble intent. And so I think it does bear repeating. And we do repeat it. That looking after our physical self is the first step, the first essential, I think, in looking after the body, and exercise. Very important. I don't know about you, but with more downtime and more time at home, that elliptical trainer that's been in my basement for the longest time is now getting active, as am I, almost every day. And oh my goodness, what a pleasure that is. And it only takes 20 minutes. I only normally spend 20 minutes most days on that elliptical and feel good for hours afterwards as a result. Like, I knew it was important, but I'm learning now even more so how important and how effective it is. So there's a plug for all of those things. Let's shift to the A, which is for affect, attitude, the psychological things. And there's a lot that goes on under this category. But today, passing quickly through these and wanting to sort of land on an essential, it's mindfulness that I'd like to talk about. Now, down at the bottom there is a YouTube link, which I won't ask James to click on. But if you have access to that link to look at later, perhaps, it's a very clever and a very cute little cartoon, which I actually have been showing for years. And full confession, I've been showing it for years as a plug for mindfulness without having any mindfulness practice of my own at all. In the last 2 years, I've developed my own mindfulness practice, and boy, that little cartoon matters to me even more than it used to. Let's see what's on the next slide here, James. It's just a clever little cartoon about opening up the mind and out the junk. I don't know about you folks, but I find that my mind gets really cluttered up mostly between 2 and 4 in the morning. When I just seem to have to review all the garbage that's going on and everything else. And that's really not that conducive to a good night's sleep. And I have found that it's mindfulness exercises and mindfulness practice which helps me break out of that cycle of the ruminative kind of thinking or the obsessive kind of thinking. So on the next slide, we're going to talk ever so briefly as to what it is. I'm hoping that many of you already know about mindfulness and already have a mindfulness practice. And if exercise was good for the body, mindfulness is good for the brain and the mind. I think that you can think of them as being very similar in how one relates to the other. Lots of things happen with mindfulness practice, and it can be very short, and I'll refer to that as meditation or a meditative practice to enhance mindfulness. Mindfulness simply is being aware in the moment. What's happening in my body, what's happening in my thinking, what's happening in my emotions, completely non-judgmentally, completely open to whatever it is right then, right there. Meditative practice helps us develop that kind of mindfulness, and that kind of mindfulness is very practical moment to moment, not only to help us relax, because even a few deep breaths and in a longer presentation and in many of the meetings that I actually chair, we do a mindfulness routine at the outset just to get the feel of it and to get relaxed. It's mindfulness that helps us tune in to what's going on in our reactions and gives us the power of choice. So we don't need to be reflexively reactive in the moment. We can be consciously reactive in a moment and make our decisions about the thing that we do or say next, because it can make a ton of difference to the rest of that day or the next couple of days, depending on where our outburst or reaction might happen and upon whom it lands. So I think mindfulness is a great way to be self-aware. Did notice your chat comment go by ever so quickly, James, about journaling and so on, and I thank you for that. And I think I would include journaling along with mindfulness or mindfulness meditation and other things as ways to be self-aware, ways to tune in to what's happening within ourselves, ways to be able to pin our where we are on that color chart and be able to then know what we need to do in order to move in terms of our where we are on that chart. So let's go to the next slide. Oh, I should say too, I mentioned there a mindfulness app called 10% Happier at the bottom. I have no stake in that, and it's free anyway, as many of these online meditation apps are these days. It's certainly free for health professionals. I've used a few over the last couple of years. I'm really loving this one, and it's part of my day every single day. I start every day with either a meditation exercise from a course that they offer, or as one-offs, or recently they've been offering meditation live at certain short meditations and interviews live. Really, it's become woven right into my routine every day. Yeah, you can go to the next slide. And this is local as an opportunity. A number of providers, including Mary Elliott, who I mentioned earlier, and other colleagues, started this mindfulness practice opportunity for us very quickly after the pandemic struck. Every evening, but Friday and weekends. They were offering several sessions per evening until recently. I believe they're consolidating now into one. And it began with being for docs only, and now they offer access to all other providers as well. And there is the website where any of us can go and have a look at the details of what they're offering and how to access. Thank you, Jonathan, for your comment about gratitude, because gratitude is also part of self-compassion and part of mindfulness practice, and I am going to mention that again at the end. Let's go on to the next slide, because I'm shifting out of mindfulness here. But you know what? Before I leave it, before we wrap up, if I could give you a gift, if you could take one thing away from this talk more than any other thing, it would be to explore a mindfulness practice. I just can't emphasize, I think, the value of that enough. The cartoon, if you look at it, is called Mindfulness, It's the Superpower. And I'm beginning to believe that that's true. The S is for social, time spent with our family, friends, of course, our significant others, if we're blessed to have such a person in our lives. There's my wife, Judy, and there's my dog, Riley. I've Murray the cat, too. That's my family here at home. Of course, we've been together these last 3 months, and this is, if you could see Judy now, she's just in the other room, but her hair is an awful lot longer than that. And the woods don't look like that anymore. They're very green now and verdant. All the trees have leafed out, but that's part of our daily afternoon walk when it was earlier in the spring. And that's where my dog, Riley, likes to stop and have a look out. So we all stop when we get up there to the lookout. And this is just part of us being together and providing support to one another. And speaking of evidence, and there is good evidence that having this sort of support in your life also enhances our well-being. And how wonderful is it that in a rural setting such as I am, and I think most of you are, that we can combine these elements of resilience, being with loved ones and being in nature and getting some exercise and talking. All of these things overlap and intersect. Let's move on to the next one, because I want to spend a bit longer. Well, actually, the one after this. This is just the reminder. You know, if there's stuff you love to do and have loved to do, don't abandon it. Some of us, of course, have more time at home these days, not less. So there's plenty of opportunity, and certainly I find myself with my guitars. I like not only music and not only playing them, but I also collect them. So in my home office around the corner, they're all over the place. I just love being with them. And now I have more time for that and more time to refresh my repertoire and learn new songs and just sing because it feels good. Yeah, there I am. One of Judy's hobbies and activities is sewing. So she sews the masks, and I thought I would just model one for you. That's an opportunity that we have at this particular time, and I take it as a red flag if you love to do something along the lines of one hobby or another, and find that you're not any longer. We should have a look at that as to why that would be. Okay, now let's go on to the next one, which is C for community. And I told you I would focus mostly on our peer community. So I also learned this from Mary Elliott in a presentation that she gave to us as a network of systems, physician health network for our various hospital systems. Jonathan might have been there that day. I don't know. You might recognize this. It's a buddy up program. And they instituted this at their hospital, and some others have done as well. And I'm an advocate of this sort of thing. I've actually adopted this practice myself with another colleague. You simply decide to do this in your department or in your community, however you define it. Find another person, another colleague, maybe two. Decide you're going to be buddies with respect to your personal resilience and support. You decide on a platform to communicate with one another, usually something like text messaging or some other form of instant messaging. And you decide on a way you're going to communicate, whether it's verbally or with emojis or however you want. And commit to check in every day. Just a quick little how are you? I'm fine, thumbs up. I'm green, I'm yellow, I'm feeling a little orange today. Maybe give an indicator that you might want to have a chat, a real chat. Whatever it is, it's just staying in touch with somebody that you trust, feel the trust and the bond grow, and get a sense that you're not alone in going through whatever it is you're going through. You're sharing this. And if you click, I think, to the next slide, you see this "Are you okay?" which many years ago, in fact, I found on an Australian mental health website, and it was a way of encouraging us to open a dialogue, open a conversation with a friend, colleague, family member who might be suffering. And however you determine that they're not doing well, and over the years mostly I've been able to talk about that with respect to working together and getting that vibe from somebody. We're not working in as close proximity anymore, so it might be a little harder. But certainly if you have a buddy up relationship, then you should have a very clear sense of how each other, how it's going, and be able to ask, how are you okay? How are you feeling? Time to do it, safe way and place to do it. Then quietly listen when you arrange a time to talk. Open-hearted, safe, open-ended. Encourage means identify what the next right thing might be. I don't mean go into doctor mode. I don't mean go into problem-solving mode. I mean just, I care about you, and hey, maybe you'd like to check out the PHP website, or maybe you want to check in with the learner wellness office, Jonathan's office. Maybe you want to call the, excuse me. Maybe you want to call the physician health program, whatever. And then follow up is a way of saying, why don't we touch base again in a couple of days? And that encourages a person to move forward. It shows we care. And it also sets up the sort of mini accountability loop and kind of helps them take the next step when otherwise it might have been tough. And I think this is a very rich, very vital, very available means of support, which is probably all that most of us would ever need. Collegial kind of support. Okay, Jonathan, we're going to move on to the final S. James, I mean. Thank you. Which is S for spirit, as I mentioned earlier. And this is a picture that I took, seems like ages ago now, but it wasn't that long ago. It was from my patio at a place where my wife and I and some friends stay in Barbados, and we spend most of the winter there, or have been doing. I don't know if I'll get back there this next winter or not. I'm thinking probably not, but anyway. What a place to have nature all around us. Our place is right on the sea, and whether it's sunrise or sunset, it's glorious, and the sounds are glorious, whether it's the birds or the waves, surf or the wind. I was smart enough, I guess, I had enough foresight before I left there this last winter to make a long video recording of just the waves and the sky and the sun and the sunset. It lifts me up now when I need it. So it's the majesty and the awe and the wonder of outdoors and the natural world in which I know to more than most. And you know, I think you probably all know the value of walking on the green and the uneven ground. So we're very lucky for that, and it does lift the spirit. Let's not forget that. But I wanted to go on and talk about compassion specifically as an element of ways of nourishing the spirit. So, and compassion is getting a lot of airplay these days. So what is it? It's sort of a combination of empathy and wanting to help. So first, it requires sort of noticing. And we've been talking about the awareness, noticing in ourselves, noticing in our colleagues, as I've mentioned. And there's the mindfulness component to that, as I've been saying. Then there's the cognitive component of trying to understand what the ups and downs are, what the actual events that are contributing to whatever is causing some stress or distress, even suffering to someone else. That's also part of empathy, by the way, as is the more emotional component of empathy, where we're trying to really get inside how another person feels and be able to have a sense of that. If it stopped there, it could be frustrating and it could be draining for us in terms of taking on someone else's distress or suffering. But the final component that elevates the experience to the level of compassion is the desire, at least the desire. And just the desire is sufficient to be helpful and to offer good wishes and to want the other person to have or a break from their suffering. But oftentimes, of course, and especially for us in our jobs and our lives, there are plenty of things that we can do to help. And taken all together, this is compassion. Looking at the next slide, it's one that I have used over the years when I talk about burnout. You know, if COVID is pandemic, burnout is endemic. And while I'm not here specifically to talk about that today, I liked the image, the graphic of carrying the load. And early on, when I was struggling with some of this, trying to get up, ramp up a whole range of activities to help doctors cope at the front end when the pandemic hit, and finding myself facing barriers and frustrations in that regard. One day, my wife just slipped a little message to me by text, and she said, "Not everything that weighs you down is yours to carry." And I felt instantly better when I thought about that. Because I don't know about you, but I do tend to take a lot onto myself and do tend to feel like I shoulder a lot, or my tendency is to shoulder a lot of responsibility. And sometimes I need to be reminded that, first of all, it isn't all mine necessarily in the first place. That's one thing that makes the load a bit lighter. And then, of course, the other is having opportunities just to put it down once in a while. And if we don't put it down, that's when we can burn out, become ill, move from yellow to orange to red. And sometimes it's just an attitude change is all that's required to help us know and feel better about being able to let go of some of this burden. It's a kind of giving ourselves permission. The next slide is sort of the last of my thoughts, because it just puts the dot over the I and crosses the T. It says that compassion for our own selves is just as important as compassion for others, because I think without one you can't have the other, or you can't have it for long. So what I'm trying to get to in this talk and in this time, as I have been all my career, to be honest, through lessons learned through lived experience, through lessons learned working with doctors who are in recoveries of various kinds and need to practice resilience to maintain their recoveries, to these extraordinary times, to all times that we practice in where we have the occupational health risks of burnout and everything that goes with that. Self-care is not an optional extra. It's not a luxury that if we can get to it, that would be good. But most of the time we can't. I've said at other times, and what I've heard others say is, this is a time for radical self-care, where we need to go the distance, find ways to do it, even if it means saying no to some other things. Being a strong advocate for ourselves and our own well-being, because, again, as I have not had time to dwell on this today, but research does show, and that should matter, we can't bring our best to patients, we can't do our job optimally, and indeed, unless we're at our healthiest, we can't expect our patients to be at their healthiest. Said another other way around, healthy doc is a healthy patient. So there's nothing but upside that attends to our looking after ourselves. So I'll just wrap up with a refresher of the 6 essentials I've gone over. Looking after your physical health, learn a mindfulness practice, value and cherish your time with your significant others and close friends that we trust and from whom we get energy. Keep our hobbies and special interests alive, carving out the time for that. Buddy up one way or another if you can do it. I really heartily recommend it. And compassion for others and compassion for ourselves. There are plenty of resources available to you, more now than ever before. In fact, it's utterly bewildering, the resources that are now available locally, and that's what most people will use. And within our profession, of course, don't forget my physician health program. Most of my professional life has been devoted to that, and to you, therefore. There's the intake line right there, and you don't have to have a drug and alcohol problem or a mood disorder to call that service, and it's confidential if you want it to be. By the way, just this week starts a whole new service by the Canadian Medical Association, which is a 24/7 wellness line. It's a bit more of an EAP style with counselors and so on available all the time and for free, paid for you on your behalf by the CMA, and integrated right in Ontario, integrated right into that PHP intake line, which you see there. So if you happen to call that line, you'll get a choice. Do you want the 24/7 line, or do you want to be passed on through to somebody at the PHP? So like I said, there's no time better than now, that if you're struggling in some way or you're concerned about someone else who might be struggling, including family and so on, there's lots of help, lots of advice available. Please use it sooner rather than later, and that's what we're there for. That's what we look forward to. I'm done. I have my own email through the OMA there, and the PHP website is there. And I think at this point, we would see if there's any other questions or comments.
So thank you for that, Dr. Kaufmann. That was wonderful. I always absorb something new from you, and I feel more centered just having listened to your voice for the past few minutes. There are a couple of questions that I want to get to that came up on the chat, but first I'd like to invite Dr. Whitney to provide some commentary.
Thank you, Michael, for that excellent talk. I'm just going to summarize a few highlights I'm going to take away from it. I mean, you started with the military, and I think that's where some of the roots of this go. The Road to Readiness, Mental Readiness is the program. It's actually an app I have on my phone, and I would encourage people to think about it. I think it works really well in teams. So could it work for your inpatient team in the Emerge or the Emerge team? The buddy system always goes back. Also, it's the military. When you go on deployment, you pick a buddy, and that's who you're buddied with while you're away. So it's an important role. And then moving it on to more nuances today, mindfulness. I think you captured that very well. I would put a plug in for mindful activity. Some people aren't meditators, so I often teach my patients to look for areas of everyday tasks they do, such as washing the dishes, petting the dog, doing those activities. And there is also, if anyone's interested, they can contact me. There's an organization online out of Toronto called Neuro Novo Center, Jackie Gardner-Nix's group, who provide mindful movement in a meditation way. And then of course there's yoga. I guess my final comment is moving forward with this is a marathon, not a sprint we're involved with. So I think that the things we need to be looking for to do, I think, are possibly going to change over time with a sense of unpredictability and threat. So I'll leave it there. I really enjoyed your talk, Michael, and lots of neat and current elements there.
Thank you, Diane.
Thanks, Diane. So I have a couple of questions that have come through. The first one is a very practical matter. So we had a contributor who asked, and I think this is for Dr. Kaufmann, does the PHP have any resources for rural and remote physicians? And I think this context was especially in respect to private counselors who either are situated near or could serve physicians outside of the urban centers, even the ones in Northern Ontario.
Yeah, the short answer to that is yes. It's always been an activity at the PHP to recruit resources from all over the province. It's a dynamic process and constantly changing. So I've been a bit out of that loop in the last year or two, but it's always been important. And we've more recently, even before all of this hit, found ways to tap into virtual resources as well. Of course, now they're all virtual, it seems. Yeah, a call to the PHP, and if you sort of skip over the CMA intake line and talk to an intake colleague there, they would be able to help with that.
Diane, Whitney here. if I could just add on, during this, I actually provided my name to the OMA PHP as a resource if they needed it. And I was contacted actually within the last week and saw someone within the northern environment. So you could be both sides. You can also be a provider if you're interested. You can also be a consumer as well. So I think the more we build the network, the better it is.
Wonderful. The next question, I think, ties in very well to your comment about not everything that weighs you down is yours to carry. So Lisa Kokanyi had put forward a comment around the lack of public understanding around infection and disease control has left a lot of physicians feeling exhausted by having to constantly correct misinformation on public platforms. And I think SARS was 2003, which was when Facebook first came into being. And so this is kind of a new burden that healthcare professionals have. And it's been very natural for guidelines to change as new information comes to light, but the speed of that has really been dizzying over the last few months and very hard to A, maintain public trust, and B, protect the public. So I wonder if that's something that you can comment on.
Are you asking me or Diane?
Both.
Okay, you first, Diane.
Oh, thank you, Michael. Well, I sometimes actually find my role some days on the phone, in particular early on, not being a psychiatrist, but being a resource person. Right, sort of helping people sort of sort out as best as I could understand what was going on. I now often get asked predictions of what I'm taking. I think, though, what we're talking about here of the whole aspect of the choices we make and the lifestyle we adopt through this is I do tons of that kind of work on a day-to-day basis in my office, or actually over the phone, not in the office, to help people find that right balance. Sleep has been a huge issue. Huge in trying to avoid medications. I've also found, I'd say the other piece I'd say is my patients with more serious mood disorders, because that's what I treat. A lot of them have not done well, right? Sort of the more seriously mentally ill, and managing some of them has been a challenge and takes creativity. I would say I was in contact with them more often because the telephone allowed that. So some of them I would call every 2 or 3 days just for 10 minutes.
Jonathan, while Diane's been speaking, I've had a chance just to get a thought or two on that question about being a source of a resource, an information resource. And I actually find myself doing that with friends because I don't have a clinical practice anymore. And so at a very low level compared to the way I'm sure you guys are called upon to do. And I don't really have a perfect answer for that question. But I had another conversation with a colleague a few days ago who is, on a related matter, is finding herself in uncharted waters in terms of, I've been called upon to do this, but it's not where my strengths lie. Yet feeling that still had to provide the resource or provide the answers, when really all she had to do was figure out who else could provide those answers, or where else a person could go, and redirect the original person to that other resource. So I don't know if you have that option or not, if there are trusted sources that you can redirect people to after a short conversation, and just find ways not to take it all on yourself, if it's practical.
Yeah, that's a really great point. And I think our experience here in Ontario and in Canada and at NOSM has been that the leadership has been quite strong. And so there always has been that trusted voice that we can refer on to. I think we probably have time for one more, and it's actually something that I wanted to ask the two of you. And it's about the concept of guilt, which was somewhat of a surprising issue that came forward throughout the pandemic, especially in our experience with some of the learners. So as you know, the impact of COVID has been kind of uneven, not just amongst the general public, but amongst healthcare professionals. So you're in Toronto, Dr. Kaufmann, and in Northern Ontario, we've had our flare-ups and we've had our scares, but nowhere near the disease burden that the GTA has had. My best friend's an ICU doctor in Hamilton, and his experience has been very different than a pediatrician in Sault Ste. Marie, where we haven't really had any hospitalized patients with COVID at all. And so in a lot of ways, the worst case scenario never came to pass. And rather than hearing from a lot of learners who were scared about COVID, we actually heard about more learners who were feeling sidelined or feeling ineffective, or that imposter type feeling that they weren't deserving of some of the appreciation that was going around. And guilt actually became kind of the dominant theme amongst a lot of healthcare professionals who weren't right up front. So I'm wondering if that's something that you can comment on. Is that something that you've had to deal with some of your clientele, and what kind of messages seem to resonate?
Well, first of all, very important point. In Toronto, I live in a very rural community, 2 hours drive away from Toronto. So actually, locally, the experience that we have here is much like you described, although I'm not in clinical practice here. I know about that guilt. I work with doctors at the Osler healthcare system, and I know that some of them are right on the front line and overwhelmed with that, or were. Others are behind the scenes or even at home and feel the impacts of that. You know, I think we're inclined to feel guilty. We have high expectations of ourselves, and we want to pitch in. It seems we can always find something to feel guilty about. That's okay. I think in using a mindfulness approach to that, if dare I do that, I would say, okay, that's interesting. Sit down, reflect on it, notice it, be curious about it, ask yourself what it means, forgive yourself for it, take the lessons from that, and move on to the next thing. I suppose as well, if you've got a buddy, it's something that you could share together. And I bet that when you talk with each other about that, you can do a lot to help encourage one another. That you're learning, whatever it is you're going through, you're learning. And be careful what you wish for. It's a long career. This is far from over, and we'll have every opportunity to be in the front line of one kind or another. Get ready for it.
Yeah, thanks. We also tell our residents, you know, the clapping is for you. The signs of appreciation, those are for you. Even if you haven't seen a single COVID patient, you're out there, you're risking your lives, and you are appreciated.
It's Diane Whitney here. If I could make, I'll use a military analogy. I served in the first Persian Gulf War, where we had constant threat of chemical, biological warfare. I spent many hours in a gas mask, not a fabric mask, and a poopy suit, right? But we were told when we came home, no one died in that war. So is that war acknowledged? Is our contribution acknowledged? And I think many of us shifted to that we had been through the experience, you know, we made a contribution, whatever it was, and to acknowledge that and not let it be and be dismissed, because I think people have been impacted by COVID, and healthcare professionals have to get ready. I mean, I'm sure my residents are ready to kill me the day I gave my presentation and asked them which patient they were going to take off the ventilator, and their excuse was, we're psychiatrists. And I said, doesn't count here. So I mean, I think we psychologically prepare ourselves, and we have to be prepared for the next round. And I think that's where I think also have to put the focus. So that's sort of my military analogy. You prepare for something, it doesn't always happen exactly the way. Sometimes that's good.
I'm just going to squeeze one last one in here. I know that it's 1:29. The notion of the perception that virtual clinical care is easier on physicians as they can just do it by video. Perhaps some insight on the actual additional stressors in providing virtual care and how to ensure we're taking breaks and ensuring self-care.
My comment's going to be, I totally disagree with that. 75% of my care has actually been over the telephone rather than video because of various reasons, people not having the technology. I found myself going home with headaches and more fatigue when I first started doing it. So I mean, in some ways, yes, it's easy. You can do it with your pajama bottoms on at home. That's easier. But I don't think it is necessary. I think it gets easier over time. And I think also what we've seen, it happens, the disruptions that happen as well. but you lose that divide as well sometimes between home and office. So I don't think it's simply easier. I think parts of it are easier, but not necessarily all of it.
Yeah, I'm not too sure if the question implies that it's easier. I would agree that the shift to virtual care, it's part of the adaptation to what's going on, which is dynamic and constant, and I suppose it'll be changing. And while it's easier in some ways, I know it's going to be a lot tougher in other ways. And folks are having to find their way with that as yet another new thing, yet another change of somewhat in their control, somewhat not in their control. So I think that just fits with the whole paradigm that we're enduring these days. That as we're adapting to these novel changes in the way our profession is and how we practice it, it just circles back to where we began, and that is a high quality resiliency practice is vital. And I mean, I only touched on each of these domains, but I'll tell you what, to this day, I can't imagine functioning in the world, let alone in the profession, without being highly connected to peers and other people who care about me as I would care about them. And whether it's one-to-one or groups or both, ideally. And virtually these days, we can be in groups, even perhaps more easily than we used to be. You know, run, don't walk, to find yourself that kind of environment so that you can share with people down. You get the practical advice and you get the support for the impacts, the psychological impacts and emotional impacts of all of this change. And that's what we do. We take a day at a time, to use a cliche. We help each other. We practice our resilience. We adapt, and hopefully to maybe end. So do our systems to enable and facilitate our working in novel and new ways, whether it's hospital-based or community-based. And as I think we said along the way, that this pandemic time, this time of drastic change, it challenges us to be better and different, and let's not waste the opportunity. Let's sink our teeth into it. Let's embrace it. Let's change with it. Let's adapt in a healthy way. And even when it changes again, let's bring those skills and those principles and those values of self-care and mutual care forward into goodness knows whatever the next thing is.
Those are wonderfully inspirational words to land on. And so I think I will just leave it at that, and I'll pass it back over to you, James.
Thanks so much, Michael. Thanks so much, Jonathan. Thanks so much, Diane. Give everyone a challenge. Take 2 minutes to reflect on what has just been said and fill out an evaluation, and provide our team that presented today, in particular Michael, some feedback on the presentation. What resonated for you? What did you learn? What are you going to apply? And use it as a bit of a self-reflection break for the next 2 minutes. So really encourage you to do that. As well, consider joining us next week for COVID-19 rounds. It'll be the last in our series. We've got 2 great presenters from Northern Ontario, Dr. Janet McElhaney from Sudbury and Dr. Peter DeBaker from Thunder Bay. We'll be looking at improving COVID-19 decision-making, and that we don't know when the second wave is going to come or the third wave, but we know that COVID's going to be around for a while, and we will be required to make tough decisions in the provision of care in the future. So thanks so much for joining us. Think about your own self-resiliency. Take time to care for yourselves. Reach out to the people that you love virtually or in person if you can. And join us back next week for COVID-19 rounds, 12:30 on Fridays, Eastern Standard Time. Thanks, everyone. Have a great day.